remember sitting up in bed and just grabbing him at 2 a.m. and saying, I can't breathe, I can't breathe. And he took my pulse, and he could tell that, that my rhythm was off. And he really encouraged me to go to call 911, and I didn't. If I had something like that again, I would go to the emergency room. I would call 911. I was being stubborn. I would encourage anybody, don't ever ignore your symptoms.
Lots of people have mitral valve prolapse and they live with it their whole life. And she really had no issues leading up to the, that one episode that started this whole journey. And so it really kind of came out of left field, honestly.
He sprung into action and got me in to see Dr. Manchi.
Stephanie was born with a mitral valve prolapse. Normally the valves close in a straight plane, but her condition, the valve was bulging into the upper chamber. We see different variations in the mitral valve prolapse itself. Her case was a little more severe or serious case.
He put a Holter monitor on me, Dr. Manchi. He called me up on the phone and he said, "What are you doing right now?" And I said, "I'm getting ready to go to class." And he said, "No, you're not." And he said, "You are in a 12 count of VTAC right now. How are you not on the floor?" And I just remember how impactful that statement was. And I guess my body had just been compensating for so long, but it wouldn't do that forever. He said, "I need you to come to the hospital, and we're going to run some tests." At that point, he had pinpointed that what he thought all along, that it was truly my valve was failing. He told us that he wanted to schedule my surgery with Dr. Sebastian Pagni.
She had a mitral valve with bileaflet prolapse. The mitral valve has 2 leaflets, and both of them were widely open, and she had some fibrosis and scarring, suggesting that maybe she had some infection in the past. We were not sure, and we tried to fix it, but it was too much of a try. Eventually, we replaced the valve because it wasn't going to work. There was a residual leak, and it's not good to leave that in a patient, so we replaced her valve, and she did very well.
Honestly, it was like she couldn't even carry a gallon of milk.
You take things for granted, and not everything is as bulletproof as it seems.
We like to go to the Y and exercise, and we do like to go to our concerts, and she's herself again, which is great.
We have multidisciplinary conferences and meetings every week, and I think usually that results in a better outcome, or at least in an agreement of what should be done or not.
Baptist Health provides a very comprehensive care, and the cardiology care is complete here.
Every aspect of my care from start to finish was amazing. I felt well cared for. I felt like I was the number one person in the room from the time I left the hospital to my appointments. I mean, everyone truly, genuinely cared about my well-being. Coming to Baptist Health Floyd was life-saving.
What gets my blood pumping? Her.